decided to expand its vaccination drive from the 1st of May to now include all above the age of 18. So far, the vaccine program has been limited only to those over 45 years old and frontline and healthcare workers. Several other important decisions were also taken at a meeting chaired by the Prime Minister. The third phase of the vaccine drive aims to encourage vaccine makers to augment their production by providing them with incentives. Vaccine manufacturers can supply 50% of their monthly doses to the central government and would be free to supply the remaining 50% doses to state governments and in the open market. Joining us now to understand where things stand on the supply side as well as what can be expected in terms of a ramping up of vaccine production is Renu Swarup, the Secretary of the Department of Biotechnology, also a member of the NEGVAC. Ms. Swarup, always a pleasure. Many thanks for joining us here on CNBC TV18. I want to understand, ma'am, what the situation currently is in terms of supply. So far, the government has maintained the reason why there was an age cap of 45 is so that the supply could be commensurate with the need. Now, we have decided to open things up to all above the age of 18 from the 1st of May. But do we have enough supply to cater to this large population?
So thank you, Shireen. And I think you have been tracking the whole vaccine development, production and manufacture over these last couple of months. And you would have seen that in January, we gave the first emergency use authorization to two of our vaccines, the Covishield and the Covaxin. And you do understand and appreciate that manufacture of vaccines, ramping them up is a complex issue, and it takes its time by the time it can be ready to be made available in sufficient numbers. As we stand today, the facilities both at the Serum Institute and the Bharat Biotech have now been able to come to a situation where they are ready to ramp up their production. And in addition to the facility at the Bharat Biotech for Covaxin, we've also been able to bring in other manufacturing partners who can take on the Covaxin production. And you would have read about it a couple of days back. We put out that press note. So with this, we are confident that the capacities for both these vaccines will increase. We also now have a third vaccine which has been given the emergency use authorization, and that is Sputnik, which is an Indo-Russian partnership. There again, we are looking at manufacturing happening within the country, but to begin with, there will be doses which will come in as imported vials, and then also the drug substance which will be brought in for fill finish. So I think this is clearly a situation where we are in a much better position than what we were in January when we began this whole immunization and vaccination drive. So it gives us confidence that we will have supplies now being ramped up to meet the requirement and the demand as it moves on.
Right. Ms. Swarup, several things that you've mentioned there, that we are in a much better position versus January, and I don't think anybody can argue with that. But again, as you point out, that, you know, ramping up vaccine production is a complex thing. It's not as if you can switch on a light bulb today and it comes on stream tomorrow. So what is the current production capacity, both at Serum and Bharat Biotech? And by when have these companies told you that they will be ready to actually augment capacity? You said that they are ready to ramp up, but when will they be able to start production from the additional facilities?
So this is already happening, Shireen. It's not that there is a, like Serum, they've already begun their work onto it. And when we say begun their work on it, you see when vaccine production has to move into a new facility, the fill and finish lines have to be validated and put in place. The actual bioreactors have to be developed. So all that has been happening. That's what I said. These months have actually been used to ramp up those facilities, and they are now ready to take on large-scale production. Both at Serum, where they have taken on this additional facility which they are working on. Similarly, at Bharat Biotech, they have within Hyderabad itself 4 facilities that they have got ready to take on this production. They have a new facility at Bangalore which they are bringing into this production. So many of these facilities were earlier set up, keeping other vaccines in mind which they were preparing to manufacture. And now they've taken this on for the COVID vaccine. In addition, we have also brought in 3 other partners for Covaxin, the Indian Immunologicals at Hyderabad, the Hafkin at Mumbai, Bibcol at Bulandshahr, Now, these are where new facilities are being brought in. So those would probably have a time frame of about 6 months or so to come in. So it's not just for 1st May, but keeping the supply chains ready for the next couple of months.
Yeah.
But then we also are also confident because there are a number of other candidates which are in their late stage of development. We have the DNA vaccine from Cadila,
Yes.
which is already now completing its phase 3. So we do look at that coming in for the regulator's approval very soon. Similarly, we have Biologically in Hyderabad. Their vaccine has completed successfully its phase 2, and they are now going into the regulator to begin their phase 3 and then move for the data generation for that, which again would be a matter of weeks or months by the time it comes to the regulator. There is a very important provision which was made in May last year, which allowed the manufacturers to do stockpiling even while they were doing the phase 3 trials. So this allows our current manufacturers who are in phase 3 at risk, at their own risk, to start a stockpiling, so that the day they are ready for an approval, we will have batches which are ready to roll out. You saw that in the case of Covishield, you saw that in the case of Covaxin. So that again gives us the confidence that in the next couple of months, we will have more such candidates rolling out for our immunization program.
Yes, the pipeline is looking stronger, Ms. Swarup, but I wanted to understand what happens from the 1st of May. Because at this point in time, you're going to open up now to those above the age of 18, which means a large population will arrive at vaccination centers. How that process is going to work through the CoWIN app, etc., we still require clarity. There is the added element now of states having to procure directly from vaccine manufacturers, as well as the private market being able to procure directly from vaccine manufacturers. So I'm trying to understand what happens on the 1st of May, because till the 1st of May, I imagine that the supply remains as is. Is that not the fact?
No. So in April, we are looking at increased supplies. Sputnik has come in as a new partner, which is also going to bring in supplies, which will come in during the month of April itself. And the Ministry of Health has developed a very clear plan on how this will happen. So this has been well thought out by the Health Ministry, and they do have a plan of action on how they're going to work with the states and how, I mean, this has been in talks for some time now before this decision was taken to open it up. So the Health Ministry has been working on it. And if you see the way they have been able to put out first for the healthcare workers, the frontline workers, then above 60, above 45, it's been done in a graded manner. And I'm sure that with all the experience that the Health Ministry has and the discussions they've had with the state government and many of the private players as well, they will be able to take care of this.
Right. Ms. Swarup, you said that you expect Sputnik to come into the market by April. But we had Dr. Reddy's this morning, the distributor for Sputnik, saying that the imported consignment, the target is only end May or June. So there seems to be a difference between what the government is expecting and what the companies in question are expecting.
So there are two things in that, Shireen, and which I would like to point out. One is that there are imported vials which would come in, and they're working on that. So April or first week of May is really the targets that were being looked at. Then there is a drug substance which is to be imported into the country, which we'll be putting it for fill and finish with one of our one or two or more of the manufacturers they are currently in discussion with. That will take about 30 days time for it to be put through the fill and finish line, get the regulator's approval and move out. And parallelly, the 5 manufacturers that they have worked with, out of those, 2 of them are in an advanced stage of manufacturing, and those again should happen by June. So there are 3 steps through which the Sputnik vaccine is currently in discussion.
Okay, but ma'am, again, has this been communicated by RDIF that they are going to bring in the first batch of imported vials into India by the end of April? Because I go back again to the conversation that we had with Dr. Reddy's this morning, where it was very clear that they're only going to be bringing in the imported consignment towards the end of May or June.
So the information that we have within the government from our discussions with RDIF is by end of April or first week of May. If there is some change in their stand this morning, we will have to check back on that, because that's really the information that we have from RDIF.
Let me now talk to you about J&J and Biological E, because this is also part of the Quad initiative and is being supported by that. You said that you expect J&J and Biological E to be able to start manufacturing in India, and perhaps J&J will also use the import route to first enter the Indian market. How soon do you expect that to happen?
So you have to remember one thing, Shireen, Biological E is actually looking at two things. One is their own indigenous candidate, what I spoke to you about. They've completed the phase 2 and they are now with the regulator to get the clearances to move into phase 3, which is their own RBD protein candidate that they're working on. The second is the partnership that they have with J&J, and that is the one which is under the Quad Summit as well. So there again, there are two components which are being discussed. One is the drug substance coming into the country for fill finish, which could start as soon as they have been able to work out their agreements. And the second is going into the manufacturing of that within the country. So their agreements have been signed, their facilities are being made ready. The information we have is that the Biological E would be ready to start that maybe by the middle of May or the third week of May. I mean, again, it'll have to be on the exact contracts and agreements that they work out. And the manufacturing facility should also be ready in about another 4 weeks from them. And here we are talking about large capacities. The Biological E for its own candidate has a large capacity of nearly about 600 million per annum. And we also have the capacity in terms of the J&J, which is going to be in terms of large numbers that they will do monthly.
Right. And that's an important point that you make, that Biological E, the indigenous vaccine, should have a production capacity of about 600 million per annum, and then J&J is separate. Has J&J already applied for emergency use authorization, Ms. Swarup? Would you be able to confirm that?
I would not have information on that, Shireen. That will be available with the regulator. But as you know, that there has been this recent regulatory order which has been made, in which these vaccines which have been approved by international regulators can now come in for emergency use without the immediate requirement of a bridging trial, which will have to happen parallelly in it. So I think that is going to look at now, not just J&J, but others also could be in discussion to take it forward.
Yes, that is a change that's been made by the Indian government. You spoke about Zydus Cadila, and you expect that that could be the next vaccine candidate to get approval from the regulator, as well as their ability to stockpile at risk. Would you know whether there is a stockpile, a substantial stockpile that Zydus Cadila is already sitting on at this point in time? And do you expect the regulator's approval for Zydus Cadila to come in June, closer to July? When do you believe that this will be available in the market?
Very difficult to put an exact date on it, Shireen, because their data is just coming in and that data needs to be reviewed by the regulator. But looking at the scientific data which has been assessed by our scientific committees which look at it, we are confident that this will happen very soon. How much they've been able to take in, or are they taking into stockpiling? Again, I think this is going to happen once they are being able to put in the data for the consideration of the scientific committee.
What is the plan now as far as the Department of Biotechnology is concerned to support ramping up of production? We've just seen the government give the go-ahead for 3,000 crore rupees to Serum and 1,500 crore rupees to Bharat Biotech as supply credit. They were, of course, hoping for a grant, but what is the plan now in terms of additional financial assistance to some of the other manufacturers who are now looking at adding to the supply chain?
So the announcement yesterday for the 3,000 and the amount that's going to Bharat Biotech is for their commercial manufacturing. The Department of Biotechnology, as you're aware, has been supporting, since this pandemic began, the research and development, bringing the candidates right up to a stage when they're ready for licensure through both financial and technical support. So all these candidates that I've spoken to you about have been supported both financially and with technical support to bring them to a stage that they can get into phase 1, phase 2, phase 3. We have, in fact, under the Atmanirbhar Bharat Package 3, announced the mission COVID Suraksha. And as a part of that, number of candidates have been supported now for clinical trials, including the mRNA vaccine, which is being developed, and that's also started its phase 1 by Genova. We have a nasal vaccine, which Bharat Biotech has started. Those are all in phase 1. So again, likely to come up very soon. In addition, under the mission COVID Suraksha, we have just made some commitments to be able to support, as I said, Covaxin manufacturing scale up, not just in Bharat Biotech, but these three companies that I spoke about, Hafkin, Indian Immunologicals, and Bibcol. So that is the support we are giving. As other candidates come out for manufacture, they get ready with the regulator's approval, there will be other facilitation that we provide, and we'll be happy to consider that as we've done for these candidates.
Right. Ms. Swarup, I want to go back again to the supply issue. At this point in time, what is the stockpile that the government has readily available with it so that this can be put into use from the 1st of May? What is the current production capacity at Serum as well as Bharat Biotech? And how much will they be able to ramp up, for instance, in the month of May or June?
So the exact stockpile as of now, Shireen, these figures would be with the Health Ministry because they do that on a daily basis to be able to assess what the stockpile capacities are, how much is the demand, how much is the supply coming in. As I said, I would be able to just say this very clearly that the current stockpiles, the current demands which have been assessed are based on the capacities which are available currently with Serum. The commitments that these companies have made for capacities to be available to us starting, I mean, it's literally on a weekly basis which is being assessed. So based on that, these commitments and these strategies have been worked out. As I said, Serum it's already started its ramping up, so they're going to give enhanced capacities from in fact, it's already happening now. So each month from January onward, their capacities have been enhanced, and they are going up with enhanced ones in May, June, and then moving into July with much larger ones. The Bharat Biotech, they were earlier working with 2 facilities in Hyderabad. They've now got their other 2 facilities ready, which is going to start in May itself. So that's immediately going to double what their existing capacities are. And then take on this Bangalore facility, which also should start sometime in end of May or first week of June.
Right.
So this entire planning has been done keeping these capacities in mind of the existing and also of the new vaccine, which has been given emergency use authorization.
I would imagine that the Health Ministry is probably going to put out details on what the plan will be to involve states in this and how that's going to work, because 50% of the production goes to the central government and the balance 50 vaccine manufacturers can place with states or in the private market. Now, you know, this seems like a challenge at this point in time because A, we don't have clarity on pricing for states, and B, in the interim, till we actually see a significant ramp up, you know, there is a fear that this could lead to more confusion on the ground. Many people are already starting to ask, from the 1st of May, with the age limit being dropped, you know, will it be that, you know, the government may not have enough supply to cater to the second dose that people are eligible for? We're already now starting to see centers putting up signs again saying that there is a vaccine shortage or they've run out, at least in Bombay. That's news coming in this morning. How would you address some of those concerns, Ms. Swarup?
So the planning that I have just mentioned to you about the 2 vaccines being scaled up, the third one being already there now in discussions for being brought in, discussions happening with these vaccines or for those whom they've already signed contracts with manufacturers within the country. I think that is what we have assessed. And based on that assessment, the Health Ministry has drawn up the plans about how many could be vaccinated at what stage. And I think considering that, their strategic planning that they've been able to put in place is keeping all these factors in mind before they're making their schedule. So I would say that the facilities have been already prepared. Vaccines development, manufacturing, the scale-up plans that we have are in line and in sync with what is being proposed for the strategy for vaccination. And that really is how we've gone all these months. And we've had our plans working with our vaccine manufacturers being able to give us the required doses as per our strategies and plans which have been made.
All right, Ms. Swarup, we appreciate you joining us here on CNBC TV18 to take us through what we can expect in terms of the production ramp-up plan. Many more vaccines likely to come on stream, and manufacturers at this point in time looking at ramping up capacity, whether it's Serum, Bharat Biotech, and of course a bunch of others who are waiting for regulatory approval before they can launch their vaccines in the Indian market. Always a pleasure. Appreciate your time.